My friend who's a flight nurse was like blown away at my level of detail and accuracy with what I was speaking about directly after being extubated. And they were all saying stuff like, well, I wasn't there. I don't know. I wasn't there, like all my medical team people. As if what I'm saying couldn't possibly be true. I said, yeah, my doctor looked me in the face and said, I don't think you need blood. As my blood pressure was 70/40 and my heart rate was like 140s, 160s. And the bed is filling up with blood. And then she, of course, proceeded to blame my uterus for the problem and blame my choices for the cause. She said, you have uterine atony, and it's because you had a prolonged labor and wouldn't let me C-section sooner. And that's not the cause. And she's the only one that charted uterine atony in the first place. Everybody else said my uterus was firm in midline. So who knows if I actually had uterine atony, and even if I did, atony is sometimes a symptom of a bigger problem. If you have a lacerated artery, your uterus might be filling up with blood very quickly and it can't contract down. And it doesn't mean that the muscle itself is fatigued and that's the problem. It could be that the lacerated artery that's pulling blood into your uterus and abdomen is the problem. So since all this has happened, I've read some studies, and there was a study I think in 2012 or so that talked about the importance of treating postpartum hemorrhage like any other hemorrhage, like in a trauma patient, and CTing them to see where this blood is actually originating from so that we can better treat it, because a JADA is not going to do anything for a lacerated artery. And then it introduced the possibility of laceration, which I believe happened because probably my uterus wasn't all that boggy, and then she shoved this device through a not boggy uterus and it ripped a hole in everything as my body's contracting, trying to prevent death. So, and I don't think there's enough training for JADA use either. JADA use can be great to save lives, but it needs a lot of edits to its algorithm and when to use it, and better training for physicians to use it. Anyway, it would have been better if she had stopped touching me and sent me off to embolization. I forgot to mention, after I woke up initially in the OR, so the first procedure they did was the JADA, passed out because of the JADA, and then the second procedure they did was embolization, and that was after they started the mass transfusion. Embolization confirmed that I had a lacerated artery on the right side, the right uterine artery, and he had trouble embolizing it, but was finally successful after multiple attempts. So then I woke up in the ICU, and I still had the JADA in place. Their plan was to keep it in for 24 hours, and I was getting continual fundal massages to make sure that my uterus was midline.